Hey everyone, welcome in. We're doing something super important today, taking a deep dive into women's oral health. And trust me, it's about way more than just a bright smile.
It really is. We often don't realize how connected our oral health is to our overall well-being and how many different factors come into play.
Totally. And get this, one of the biggest factors is actually something we all deal with, hormones. We're diving into some fascinating research today that really highlights how hormones impact women's oral health across their lifespan.
Yeah, it's pretty wild how much of an impact those fluctuating hormone levels have. They can actually create an environment in our mouths where certain bacteria just thrive, making us, more susceptible to gum disease or gingivitis, as dentists call it.
Right, we're not talking just a little bleeding while flossing here. One of the studies we're looking at found that only 22 to 34% of women actually see a dentist during their pregnancy. Yeah, which seems shockingly low considering everything we're talking about.
Oh, it's definitely crucial to be proactive during pregnancy. You see those pregnancy hormones, they can make any existing gum problems even worse.
Hmm.
And even morning sickness, with all that stomach acid, it can actually start to erode tooth enamel. But here's the kicker. A mother's oral health can directly impact the baby's health too.
Whoa, okay, I did not know that. So how does that work? What's the connection there?
Well, research suggests that the bacteria from gum disease can actually get into the bloodstream and travel all the way to the placenta, which can then lead to premature birth or low birth weight.
Wow, see, this is why we do these deep dives. I had no idea the connection was that strong. It's not just about our own health, it's about future generations too.
Precisely.
And it's not like this all stops with pregnancy, right? Menopause brings a whole other set of challenges like dry mouth, which, I can tell you firsthand, is no fun. And then there's the increased risk of those more serious gum problems. Periodontal disease, I think it's called.
You got it. And a study actually found that 60% of postmenopausal women experience this.
60%.
It's a big deal. And a lot of it goes back to estrogen, that key hormone that declines during menopause. See, estrogen actually plays a big role in gum health. And when its levels drop, our gums become more vulnerable to inflammation and infection.
Fascinating. So it's like these major hormonal shifts throughout a woman's life, they kind of create these windows where we need to be extra careful, extra vigilant about our oral health.
Exactly.
And since we're on the topic of hormones, we got to talk about oral contraceptives.
Yeah.
One thing that really jumped out at me in the research was this phrase, pocket depth. What's
Yeah.
that all about?
Oh, good catch. That's a really important one. So imagine the space between your tooth and your gums.
Okay, got it.
In a healthy mouth, that space, which dentists call a pocket, is pretty shallow. But when we have gum problems like inflammation or receding gums, that pocket gets deeper.
I see. So it's like an indicator, almost like a measurement of how healthy our gums are.
Exactly. And while it's not a guaranteed thing, some studies suggest there might be a link between taking oral contraceptives and a slight increase in pocket depth.
Interesting. That makes sense, though. So again, it's not about saying don't take oral contraceptives at all, but about being informed, knowing the potential impact, and talking to your dentist about it.
100%. Knowledge is power, right?
Yeah.
Especially when it comes to our health.
Totally. And speaking of, we've covered a lot of ground with hormones, but they're really just one piece of the puzzle when it comes to women's oral health, right?
Yeah.
There are so many other factors, like certain health conditions that are more common in women, that actually have these surprising links to what's happening in our mouths. Osteoporosis, for example.
Mm.
I was blown away when I learned about this connection.
I know, right?
Yeah.
But it makes perfect sense when you really think about it. Osteoporosis, it weakens our bones all over, and that includes the jawbone. So a weaker jawbone means you're at a higher risk for tooth loss and even problems with how well dentures fit. It really goes to show how interconnected our bodies truly are.
Right. It's like a domino effect,
Yeah.
one area of our health impacting another. So taking care of our bone health in general is going to benefit our oral health as well.
Absolutely. It's all connected, just like we've been saying.
Okay, let's shift gears a bit to a topic that I think is super important to address, and we want to handle this really sensitively, but eating disorders.
Right, of course. It is a sensitive topic, and approaching it with care is essential. And with eating disorders, the impact on oral health can be, well, pretty significant. And it often shows up in different ways depending on the specific disorder.
That makes sense. So what are some of the ways it affects people with different eating disorders?
Well, let's take anorexia, for example. We often see a neglect of overall health, including dental care. It's like this intense focus on restricting food intake takes over, and other aspects of self-care can fall by the wayside. This can lead to a whole bunch of problems in the long run, everything from cavities to gum disease. And then on the flip side, with bulimia, you have the repeated exposure to stomach acid from, the purging. That can really do a number on tooth enamel.
So with bulimia, it's not necessarily the neglect, but more the act of purging itself that causes the damage.
Exactly. That constant contact with stomach acid is really rough on your teeth. It can make them super sensitive, prone to decay. It's just really hard on them. And it's another reason why, seeking help for these disorders is so important. And that includes addressing the impact it has on oral health.
Absolutely.
Mm.
It's such a good reminder that our physical and mental health are completely intertwined. We need to address both with the same level of care and attention.
I couldn't agree more.
Okay, shifting gears a bit. Let's talk about something that I'm guessing a lot of people have experienced at some point. That clicking or popping feeling in their jaw.
Oh, yeah.
So that's actually a sign of TMD or temporomandibular disorders. And would you believe it? It's more common in women.
It is.
Why is that?
That's the million-dollar question, right? And honestly, we don't have a definitive answer yet. While we don't know exactly why, some studies actually point to hormones as playing a potential role. But like a lot of things in health and science, we need more research to say, for sure.
Always more to learn. Okay, here's one that folks might not be as familiar with. Sjogren's syndrome. We found that it's 16 times 16, more common in women than men. That's a crazy statistic.
It is. Sjogren's syndrome is an autoimmune disorder that mainly affects the glands in our body that produce moisture, tear ducts, salivary glands, that sort of thing.
Interesting. So it kind of throws off the moisture balance. How does that specifically impact oral health, though?
Well, in terms of oral health, the big thing is that it causes chronic dry mouth. And when you don't have enough saliva to wash away food particles and neutralize the acids in your mouth, well, the risk of tooth decay and infections like oral thrush goes way up.
See, I had no idea dry mouth could be that serious. I mean, I get a dry mouth sometimes if I'm nervous or something, but I can't imagine dealing with that all the time.
Yeah, it can be a real struggle impacting your daily life, your oral health. That's why managing Sjogren's with the help of a dentist is so important to prevent those more serious issues.
It really shows you how essential saliva is. We've covered hormones, different health conditions, but we've also got to acknowledge that there are other factors that can affect a woman's ability to even access proper dental care, right?
100%. Socioeconomic factors are a huge part of it. Women dealing with financial hardship or who don't have insurance might have to put off or even completely forego those necessary dental visits simply because of the cost.
It's heartbreaking, honestly, because it creates this cycle where the people who need care the most are often the least able to get it.
Exactly. And on top of that, for women who have experienced any kind of violence, especially domestic violence, going to the dentist can be really traumatic. It can bring back those difficult memories, which understandably might make them hesitant to seek out the care they need. It's really about recognizing that access to health care, and that includes dental care, it's not always equal.
That's such an important reminder, and it makes me think we need to be advocating for better access, better support systems for all women. So we've learned so much today. What are some things that our listeners can start doing right now to take charge of their oral health? Because honestly, I feel really inspired to step up my game.
Right. It's empowering stuff. So where do we even start? What are the most impactful things we can do to really take our oral health seriously?
Well, the good news is a lot of it comes down to the basics, the things you've probably heard before, but, they're worth repeating because they really do work.
Hit me with them. What's the top 3?
Okay, so brushing, flossing, and those regular dental checkups. Those are non-negotiables. The foundation of a healthy mouth.
Classics for a reason, right? But is there anything we should be doing differently with those? I feel like we all think we're doing it right, but
Right.
Totally. It's more than just going through the motions. When you brush, really take your time, 2 minutes twice a day, and use a fluoride toothpaste. And don't underestimate flossing. It's so important to get rid of all that plaque and stuff that your toothbrush misses.
Okay, you've officially motivated me to up my flossing game. I'm also thinking about, lifestyle stuff. Smoking, for example. That's got to be a big one, right?
Huge. Quitting smoking is honestly one of the best things you can do for your oral health. And, of course, your overall health, too. But yeah, smoking really increases your risk of gum disease, tooth loss, even oral cancer. So if you're a smoker, seriously, kicking the habit will do wonders for your mouth.
Makes sense. Okay, and then what about diet? what we eat affects everything else, so I'm assuming it plays a role here too.
Yeah, you're right. Diet is huge. Cutting back on sugary drinks and processed foods is a great place to start, but you can also actively nourish your mouth by eating plenty of fruits, vegetables, and foods rich in calcium and vitamin D, which are great for strong bones and teeth.
Love it. So nourishing our mouths from the inside out, it's pretty incredible how all these seemingly small things can add up to make such a big difference in our oral health and, in turn, our overall well-being.
Exactly. It really highlights how interconnected everything is, and that even small changes can make a huge impact. And, going back to what we talked about earlier, it's especially important to be aware of this during those times of hormonal transition, puberty, pregnancy, menopause.
All right, those hormonal shifts can really throw things out of whack, so paying extra attention during those times is key. Well, we've covered a ton of ground today, haven't we? We explored this fascinating and often overlooked world of women's oral health, looked at the connection to hormones, overall health, even things like socioeconomic factors. And I think, most importantly, we've given everyone listening some real, practical tips to take control of their oral health journey.
I think so too. It's been great chatting about all of this with you.
Absolutely. And for everyone listening, here's a little something to think about. We've learned how important oral health is, its effects on so many aspects of our lives. So my question for you is, how do you think making your oral care a priority, really prioritizing it, how might that impact not just your physical health, but also your confidence, your overall sense of well-being? Something to chew on. Until next time, everyone, keep those smiles bright.